We do have a bunch of questions actually here in the chat, and I'm just going to look at some of them. So, um, one question is, might citizen science play a role in priming our students of today to become good One Health agents of public health in the future? How might this existing resource of the interested public and pooled data be better tapped into and refracted into a stronger One Health approach? To either of you, really.
Well, I can start, and then maybe Dr. Smith could could follow. So I think it's a great opportunity to engage stakeholders, to engage the public, to be more involved in One Health. Not only can you get some really attractive data and information rather cheaply, if you will, but then you are actually involving society into One Health and their understanding of that. So if you're collecting data and are part of it as a citizen, you're going to be more actively engaged in following studies and in doing the kinds of things that we think are important.
Yeah, I would agree entirely. And we're seeing citizen science approaches pop up more and more. So I think that is a really helpful thing to have the eyes and ears and really experiential learning as a way to really engage the public and to help show them that they're part of the solution as well.
Excellent, thank you. So, a plus for citizen science. There's a couple questions that have to do with kind of challenges, which I'm going to bring up here, on both the kind of financial and also just kind of breaking into the set ways of thinking. So one of them says, as valuable as academia and public education will be in building a future One Health workforce, the fact remains that these sectors are in the midst of a funding crisis. Could the speakers comment on how advocates in recommending new actions could navigate the fact that schools and universities are already struggling to pay for their existing programming and might not be so receptive?
Mm-hmm. Yeah, I can start with this one and we can just kind of trade off if you like. I think the funding challenge is real. We all feel it. But I think One Health is part of the solution. It can help with building a business model that is diversified and is able to find innovative ways to bring in other funding sources. So I think we need to really embrace that. I think we need to look at some of those public-private partnerships and see where can we really find added value and collaboration beyond the public and the academic spheres that we might be most comfortable in initially. And we're seeing that in the One Health Workforce Next Gen project, where there are specific private sector partners coming forward and saying, hey, we want to be part of this. We'd love to provide fellowships for interns to have placements. We'd love to find ways to move forward together. And so I think we should be encouraging that sort of thing and really broaden the inclusivity of what we're doing whenever possible.
So I certainly agree with that. Those are good comments. The one thing we've learned during COVID, or these Zoom meetings, is that we can actually build a lot of capacity without having people in one site. Katrina, you're already doing that. So the idea of building capacity doesn't need to take a lot more funding to be able to actually get some really important results. I just saw a program that Cornell put on with their College of Veterinary Medicine, New York, I think, Department of Public Health, and one of the health systems. And they're training 1,000 new people with kind of One Health, I think, competencies to work on COVID. Well, that's done very quickly, relatively inexpensively, but to be able some expertise is certainly at a beginning level. That could be really important.
Thank you. Yes, excellent points. Another, which is a kind of a challenge also, and you both addressed this and kind of breaking into the siloed system, but could the speakers comment on how to address weaknesses in education systems that result in the general public being unwilling or skeptical of listening to the advice of experts on infectious diseases? Essentially it being kind of a new approach and the recalcitrance to accepting that, or the skepticism that has been mentioned, in addition to the excitement.
So I'll start with Trina. I think it's a huge challenge right now. We've seen it, the polarization of the country is spilling over into whether you believe science or not, which is not the place we want to be. Somebody put it very well. They said, we now live in a world of trust deficiency. So it's very true. One of the things I think I've learned is, don't force these kinds of ideas on people that aren't ready to receive them. It just adds to the polarization. So take your time, start to build up the groups that actually do believe in this and move forward. And also remember that messengers can be just as important as the message. So depending on who is talking to people becomes a very important part of their receptivity.
Yeah, I think Lonnie's point to say the messengers are just as important as the message is a real key to keep in mind, right? This is not new. I mean, okay, in the US, perhaps it's more apparent in the past year given the situation, but if you think of what's been happening across Africa for many, many years, is Ebola real? Is COVID-19 real? You know, you need the right people that are locally credible. They're still knowledgeable, but they also have access and acceptability to be the ones that are sharing the messages in digestible ways. And so that is where we've seen progress and motivation from the students, from the local faculty, to be able to think about how do we effectively engage with community leaders, with community groups, because if they don't believe it's real, then there's not going to be a behavior change, right? So that's a really important part of the One Health approach, putting technical knowledge into social contexts, into digestible ways.
Absolutely. And actually, the next session is very much connected to this, but even more broadly, and actually brings in some of the main points also from the end of yesterday, which is what role could education at the primary and secondary school levels about One Health play in sustainability efforts today? You know, so that would also harken back to how we kind of ended yesterday. Any thoughts on that?
So I did, and one of the really successful programs that have been done at that level has been recycling. So the whole concept of recycling and actually the implementation was done through grade schools and middle schools, where kids bought into this. They went home and made sure that their parents bought into it. And it was a very effective strategy to move this forward. So that kind of captive audience became a collective that actually became a force in making some changes in habits and behaviors of parents.
Yeah, and we're seeing that in the food safety and infectious disease sectors as well, right? Where a lot of the different village schools, it's true here as well in the US, if the kids are hooked with the lessons and they're doing little homework assignments that help them say, hey, let's go count the eggs that my chickens are producing, or let's keep track of it in a notebook of the disease symptoms they're showing, they're finding ways to be able to really apply the concepts in real life. And if you can really bring them along at that very early stage, you're already much further on the way to success and having this be second nature, truly, which we really need. So I hope we will try to keep working upstream in that way.
Mm-hmm. And interesting. So another question actually takes it from the opposite side, or the upper side, which is what would a One Health degree program look more like an MBA? Would this be geared towards upper management who could see the whole picture, or would it be best more at the level of a professional certification that early career individuals or students could pursue, or who would hire such One Health degree holders and what are their needs? So kind of at the opposite end of the primary school.
Yeah, well, Lonnie mentioned the T-shaped professional, right? Someone on a One Health team typically needs to be an expert in something. To have a role on that team, but have a general awareness of the importance of collaboration and interdisciplinary work. So where we thought there might be the best impact from the idea of a One Health certificate or some sort of advanced credential there is probably a little bit later. So we do One Health at the very early levels to raise awareness, and I'm a big proponent of that, and I do that in my teaching. But I think for really what we're thinking about layering on, it's probably the in-service person or the additional certificate that shows you have those soft skills, you have those ability to really integrate ideas that might have the added value when you have a lot of people applying to jobs to say, hey, this person has shown that they can work well on a team, that they know how to use systems thinking. That might set them apart, and we're seeing that start to gain acceptance.
I think it's a really a good point. Another thing I'd add, I think the degree programs are especially attractive in early careers because there's a lot of interest there. But we have to acknowledge that the people hiring these workers have to have some knowledge and understanding the benefits of this workforce into getting their missions done. And the last thing is that building skills and knowledge is a lifelong is a lifelong learning. So we just don't do it and stop. It's like leadership. It's a commitment lifelong to new skills, new knowledge as you improve yourself and you improve your efficiency moving forward. So we need to think of that strategy as well.
Yes, excellent. And this is a question which is, we actually started touching on to some degree, but very, very important. High-level healthcare careers are not very diverse in the United States and have significant opportunity and financial barriers to success both in the US and around the world. It seems OneHealth might pose an opportunity to resolve the issue of diversity and equality of opportunity in the healthcare profession. Could the speakers talk more on how they envision OneHealth's role in de-racializing, colonizing and improving equity in healthcare professions? A really critical point, especially at this juncture.
Yeah, I can start. I think there's a lot of work to be done to figure out really how to tackle that. I think it's really important. I think it is an opportunity. I don't think we have all the answers. But given the current ways that we can provide additional opportunities for knowledge, for experience, for collaboration, I do hope that we will see successes that can then set best practices for how we might proceed. I know within the veterinary schools across the US, we've been working on how to increase diversity in our new incoming cohorts. And there's some really interesting work going on there. And I think that builds on some of what's happened in the human health sector. So people are starting to wrap their minds around it, but we have a long way to go, I think.
I think the only thing I'd add is, OneHealth is really about prevention and early detection, especially about prevention. So if you think about the bottom 1 billion folks in the world, and how much they really depend on animal agriculture and agriculture. The idea of preventing infections and diseases, better nutrition is really a key part of a strategy, I think, in terms of health equity. So this isn't about kind of treating cases. This really is about prevention, and especially in populations that are more severely infected through infectious diseases.
Excellent. Thank you. So we'll have room for about 2 more questions. And one has to do with infectious disease modeling and landscape. Essentially, to improve predictive capabilities and prevention at the source, it is critical to engage infectious disease and landscape ecologists and mathematical modelers to merge the complicated methodologies. Are the OneHealth education efforts including these disciplines to strengthen prediction and prevention?
I can start, I guess. The Predict project that I was previously involved in had been doing that a lot for on-the-job approaches and working with country-level teams who wanted to bring in really how do we collect data and apply it to predictive models and use that to really improve the situation and the readiness going forward. I think now that I'm in the training arm of the OneHealth Workforce Next Gen project, this is really what we do all the time, but especially for the university audience and expanding into the in-service and to the youth where we can. We still need to do that, but we're really looking at how do you first build foundational knowledge that needs to come before you can take on the fancy pieces, right? So it's a variable spectrum of learners, and we want to be able to address the needs of various stages and different levels of competency. So we definitely need it, but it's still a little bit of a niche, and hopefully we'll be able to raise and move the needle a little bit on that over the course of the projects.
So my only addition would be, over the last 5 years has been what we're doing in data analytics. We have unbelievable new resources and opportunities to look at data sets in ways we've never done before. And this data analytics becomes a whole new area of proficiency that is part of OneHealth and part of what we do. So I think that's a strategy that we really need to keep in mind that will enable us to do a lot more in foresight and protection. And when I said I think we really ought to stand up 3 national centers on foresight, prediction, and preparedness, that can be done, and it could make a big difference. I'm sure Davis will start on that right away with Trina.
Work with you on that.
And importantly, there's actually another questions just keep popping up, but do the speakers have any concrete suggestions on how to incorporate conversations about environmental justice into OneHealth education?
We're seeing that demand. You know, in the OneHealth classes that I teach, the students can choose some of the topics they work on, and they have been more and more bringing in environmental justice and a lot of those pieces that maybe weren't front and center in OneHealth at first. So I think if we listen to them and their creativity, we're all learning from each other, and I think we need that more and more.
So it goes back to defining, what the societal needs are and what our problems are. And we design competencies and curriculums based on that, not the other way around. And I agree with Latrina, a lot more interest now in environmental science, environmental health and equity than I've ever seen before. So we need to take advantage of bringing that group under the tent.
Absolutely. And then one final question to finalize this session. The aim of OneHealth is to combine disciplines, but I worry in the current systematic way we do education in the West, OneHealth might just be relegated to yet another single specialty or discipline. Will there be a need to be changes in the way we teach science as a whole to ensure that a OneHealth education actually achieves its ultimate integrative goal? A great final question.
Go ahead, Lonnie.
One of the things I've been interested in is Convergent Science. So a group out of MIT wrote a white paper a few years back about the three major kinds of transformations in science, starting with molecular biology, moving to genomics, and now they believe that convergent science is the next big opening and new era. Convergent science is just what we've talked about, bringing together different disciplines to open up new sites and new opportunities. It is one of the 10 key strategies that the National Science Foundation is putting forward and investing $30 million into as we move forward. A wonderful opening for OneHealth to avoid this singular disciplinary approach.
Yeah, and I don't think OneHealth needs to be a discipline. It is an approach. It can be a cross-cutting theme, and that's how we get away from having to design one more new course or one more new degree necessarily. We had funding to do a multi-campus effort across the UC system to build sustainability, health, and environment topics into the professional schools, in med, vet, pharmacy, nursing. And we weren't necessarily saying you have to build in new courses. You can use this with specific examples that use the OneHealth approach to convey the concepts you were already trying to do. So I think there are ways to really just update what we currently teach to build in that OneHealth approach that help to avoid some of the impacted curriculum issues.
Wonderful. So thank you very, very much to our two plenary speakers. That was fantastic, your presentations and this dialogue afterwards. So now I'm going to have to do this challenging task of summarizing this incredible morning, afternoon, or evening, depending on where you are, in a couple minutes. And so I'm going to pass on to that. Thank you again very much, Lonnie and Vartrina. And so again, today in our second day, what we tried to do is to discuss challenges and methods for introducing OneHealth ideology into existing systems and what are solutions, and assessing the current state of developing a OneHealth workforce. So I'm just essentially going to go through what we discussed because there was just such a fascinating flow of ideas. We began with ideas that can make a difference in our session that was moderated by Mark Zielinski, and Ezran Kern essentially from Tanzania discussed community-based approaches to OneHealth. And we also talked about the impact of the disruption of the environment on new diseases from James Hospitales from the Caribbean Public Health Agency. This is discussing the role of plant health in addition to kind of make sure that has a place at the table of OneHealth by David Rizzo. And then also David Goldman talking about foodborne illnesses as a part of OneHealth, and a very interesting aspect of the fact that really a lot of what we now called OneHealth has already been in existence for many years, and the kind of interface of human and animal and environment, for instance, in the PulseNet, and just looking at through genetics at foodborne illnesses, and when they matched with human illnesses and animal and environmental isolates. And so there's a number of kind of predecessors for OneHealth, which have been ongoing, and now it's kind of being named as OneHealth as well. And then we also talked with Carrie from Sandia National Laboratories about simulation exercises and the kind of breaking down silos, this huge necessity to test systems and including software that have been developed, but to be looking in advance and appreciate other sectors and realizing that even within OneHealth, there can be animal health, public health, OneHealth, ecosystem health, and making sure that new silos are not created, but rather that is an integrative approach across. Ezran talked about involving the Messiah in developing of the tools and the design of the systems that he was describing, the AFRA data, and really in the designs of the tools with the stakeholders in mind, and how that had been a very successful approach. Also, we've discussed looking at plants as serving as a model systems for human health in terms of aerial surveillance and modeling communities and populations that have, again, been long ongoing before the entrance into OneHealth per se. Other important points that came up that were adaptations during COVID, which were very important, and also took a kind of a OneHealth approach, was the during action review that Carrie mentioned. Instead of waiting for the crisis to be over, since the crisis is extending a year and beyond, to really important ways to identify new resources such as surge capacity, risk evaluation capacity, and epidemiology across different sectors and different that can be leveraged to develop policies and resource sharing. A lot of what really came to the fore was community-based tools, and what was identified as being understudied is the complexity of how things fit together and the need for a systems approach to thinking about. This is also will come back in our next conversation as well. Another common theme was the involvement of the private sector and interestingly of natural history collections, and pointing out there's one health outbreak exhibit at the Smithsonian, which everyone should go to if they can, and once traveling is permitted. Then we went into a second panel, which was really powerful, and discussing the challenges and integrations and also in coordination, and then the solutions. One issue being that these are not mainstream yet, and that it's really important to bring in to leaders above and workforce below, really understanding that this is more than spillovers and pandemics. It's really a whole way of thinking in a much more systems ecology approach. There's a lot of key questions about how to overcome the barriers in the US and beyond. In the U.S., Chris Braden discussed working with it. We are working with kind of antiquated ideas and systems of data collection that need to be modernized. Bringing agencies together to cooperate again across silos. Carlos Neves talked about very interestingly how a lot of times the developed countries are really lagging behind developing countries in having a really systematized OneHealth approach at a national level. And importantly, what kept coming up again was the need to also connect into the financial, the political, the societal aspects as well. And Christina Romanelli took it to another level of systems thinking, where we really need to look also at the root cause and build resilience with equity, very importantly. A very exciting concept that was brought to the table and is the subject of a WHO manifesto, which is a healthy, green, and just recovery, seeing us at the crux of making a decision of whether we're going to lock in damaging economic practices or, on the other hand, build towards a healthier, fairer, and greener society as we come out of this pandemic. The manifesto discusses really the protection of nature as fundamental, essential with health services, promoting food security, healthy energy, healthy livable cities, and ceasing to fund pollutant energies. Really importantly is the idea, again, of bringing in ecological, environmental dimensions as well as non-communicable diseases. We then talked about the level, the kind of the global, and then the national and the local levels a global where there's a tripartite alliance, so the FAO, the WHO, and the World Health Organization, but the need to bring in, again, the society and the community at the local level, and bringing in the ecological environments, the society, and the political will, again, and the financial muscle. There were some interesting points about how to work very specifically from Chris Brader on institutionalizing collaboration, integration, his experience in the US at establishing data sharing policies across the FDA, the USDA, and the CDC, and SOPs, standard operating principles for outbreak response, how to use molecular data. So very specifically, how do you lock in shared policies across agencies? So talking about very concrete steps as well. And then again, reaching up into the political will, which is essential, and developing a common narrative and a shared vision. So these were a lot of the points that came across, and really bringing in the concept of leadership, incentives, and the demonstration of added value. We have the data already, and the point is how to take that into account. And that essentially the most important thing at the end was really interesting in terms of what were the words that were kind of, each speaker came up with a particular word. And we had the 4 words were mainstreaming, commitment, collaborative leadership, and integration, which were kind of really summed up the discussion. We then had 2 wonderful plenary speakers who discussed the OneHealth workforce. Dr. Lonnie King in relation to competencies, skills, and milestones, and essentially the whole concept of a competency-based education and curriculum, where you start with what the needs of society are, and then build competence to meet those needs, and then a curriculum to meet those competencies, and skills to meet those curricula. And the pedagogy being experiential, based on case studies, inter or transdisciplinary, with collaborative networks, and using kind of immersion techniques and interprofessional education and practice. Critical gaps in workforce have to do with scalability, expanding kind of across education sectors, embedding key competencies into non-OneHealth workforce, and shifting knowledge to application. Again, the critical role here for de-siloing. And the kind of need for transformative thinking, especially at this moment of the COVID crisis, that looks at reform and transforming education, relational building, upskilling, and capacity building. And then we had from Vartrina Smith a very specific and concrete examples of how this is actually flowing out in reality, with COVID-19 as a wake-up calls, and students as the future. And she described the exciting work of the OneHealth workforce and the Next Generation Project, which is a USAID project that is working in Asia and Africa to decolonize global health, and described the work of the Southeast Asia University Networks, which has 8 countries and 87 universities, and growing, and the Afro-Hun, which is 18 universities in 9 countries. We heard directly from the voice of the student groups, and how it's really not just what you know, but what you know what to do, and that incredible important role of the practical experience. And then we had a really interesting discussion about the role of citizen science, about involving both primary and secondary schools, becoming a T-shaped professional with expertise, but then a lot of cross-disciplinary knowledge, and competency and comfort. And then how to use, again, OneHealth as a way to decolonize and deracialize education and the workforce. And ending with this new concept of Convergent Science, and the thought of OneHealth being really not a discipline, but an approach, and how that will take us into the future and into tomorrow's session. So with that, I thank you all for being with us today in our day 2 of this really exciting forum on systematizing the OneHealth approach in preparedness and response efforts for infectious disease outbreaks. Thank you very much, and have a great day, evening.